Thanks for staying with us. The World Health Organization has warned that the crisis in India will have an impact on many African states. The world's second most populous nation has close to 22 million COVID-19 cases so far, while the death toll stands at 238,000. India is currently battling a devastating spike in infections, which has led to a shortage of oxygen, hospital beds and other medical supplies. Several countries, including the US, the UK and a South African NGO, have sent urgent aid to the Asian country. To talk more on this, we're joined by two Indian citizens who are both personally affected by the pandemic. That's Rajashi Roy and Vanand Anand, live from New Delhi. Thank you so much to you both. Certainly it's been a difficult time as we've been watching scenes unfolding in India, seeing hospitals, turning into sidewalks of where people can even be able to find some oxygen. Rajashi, I'd like to begin with you, because this is not only about what the world is seeing, but for you, you've gone through personal loss during this time.
Yeah, so very briefly, I lost my dad in the second week of March, when the pandemic has not taken the proportions that we are seeing it today. And even then, we struggled, and the primary cause for his infection, if I look at it, was purely negligence of hospital staff. He got admitted because of a completely different medical reason, and when I admitted him to the hospital, to my horror, I discovered that none of the administrative staffs were taking the basic care of wearing a mask. I had to create a ruckus there to make them realize, which they apologized and started doing it. Okay. Now my question is, when I look back today, it was a devastating loss for me and a lot of many others that I know. When I look back today, what the way I look at it is, how did common man, behave the way they did? Okay, and what made them think that they will not be impacted? Okay, and it's a very deep-rooted problem. If I look at it, okay. People will always be irresponsible, but that cannot be an example of the authorities doing the same or passing the buck to the people. Okay, the populist perception of a country is just an extension of the deeds and action of the authorities. Okay, so somehow we felt always that there is a gap between what was being said to what was being asked from a countryman to do, vis-a-vis their actions that we have seen in the current times. So and that somehow gave confidence to a lot of people. Okay, if you go to a public place, you'll be shocked. I lost somebody who was so cautious. Even in a 10th floor apartment, he used to wear a mask when he used to go in the balcony, but yet he lost his life in a hospital when he was in the most vulnerable situation. And I don't blame the doctors. They are doing a stupendous job, but the general awareness was missing. And what led to it? I question about that. If you want the common man to take notice of the issue and act accordingly, the authorities should lead by example, okay? And their actions should not contradict what they are actually preaching.
And if I can just come in there, I'll come back to you, because I do want to talk about the issue of authorities. I'd like to bring in Vanand. Vanand, when you hear what Rajashi is talking about around safety protocols and some people really not adhering to some of the measures that must be put in place, is that your experience as well as you see your fellow countrymen?
Yes. 10 days before, that was the state in India. Now everyone is horrified seeing Delhi's condition. I have personally lost my mother as well as my father. Both my parents are no more. And, losing both parents in one go, both of them in one single frame, you're putting a garland on them, and you're doing prayers for them. It's really difficult. I have seen people, wearing masks till here on their nose. People who are in public, they are spitting. People do not take care in India unless and until it's on their own, when they feel the threat at their doorstep. Now, in last 10 days, they have seen that the infrastructure has totally crumbled. The system has crashed. The medical facilities are not there. Now they are scared of their lives. Now they are wearing double masks. Now they are wearing triple masks. But they are wearing shields. But 10 days ago, the situation was not like this. They were so careless. People were making, they were doing parties. They were having wedding functions. They were, a lot of people were attending a lot of social gatherings. People were going to restaurants. Everything was happening in India. People were careless, and it is actually, not only political parties, it is the responsibility of political parties as well as, I'll say, the responsibility of media. The media has been irresponsible in India. They have been only creating panic in all these days. None of them were giving good leads to us. Where should we take our parents? Where should we go with our patients? How should we get oxygen? How should we get medical facilities? There was nothing available. Even I belong to Delhi, the capital of India. Here, the chief minister's office, whichever official numbers they released, none of them were being picked up. These kind of politicians who actually play with the lives of people, they should be charged with murder. My parents they did not die due to COVID. They were murdered.
And,
by these people who are so careless that they did not create, in last 1 year, they did not create any infrastructure. A lot of sanctions were done by central government, were not implemented by state government. In India, the health is a state matter, which is like, it is so irresponsible that you are not putting oxygen plants, which were sanctioned in January. And my parents were, gasping for each breath. How we were collecting those oxygen cylinders every day. My brother was running, my sister was running, everybody was, standing in queues for 4 hours in sun, in 42, 43 temperature. Can you imagine? And all of them had just recovered from corona. They just felt, they might fall somewhere. They were feeling dizziness, everything. But still we were running around from pillar to post for our parents. We took them to hospital. There were no hospitals also available. There were no beds. So 4 days, my father was in home care, wherein he actually required a ventilator at that point in time only. We got a hospital in neighboring states. I got it in UP, Uttar Pradesh. I got it in Haryana, but I did not get a hospital bed in Delhi, which is the capital of India. That is the condition of the capital of India.
Such a difficult situation you're describing there, Vanand, as you talk about how things are unfolding on the ground. Rajashi, you alluded to this a short while ago. It doesn't sound like, you are happy with how government has been handling things, because when you listen to Vanand as well, she is really coming down strongly on authorities.
Yeah, so if I put it a little bit in perspective, it's at the end of the day, it's the onus is on the political parties, as very rightly as Vandana mentioned. Okay, I echo the same thoughts. And even if you look at it now, okay, the first step of solving a problem is acknowledging the magnanimity of the problem that we are encountering today. If you look at the warriors who are actually fighting for people's life, a common man forming WhatsApp groups and COVID care groups and helping people. Okay, we have not seen anyone from the authorities to come and take ownership of the issue, saying yes, this has happened and we will make it right. That's not happening. The first step of solving any problem is acknowledging that problem. Okay, and that's not there. That's not. There are governments, state governments as well as the central. They are still in a state of denial. There were statements made like there was an election happening in one of the states in the eastern India, and it was a statement was made that the pandemic and an election rally are not related.
And apologies. And Vanand, when you then look at the situation on the ground, and as we have been seeing, as you've also said this, that there's really a scarcity when it comes to oxygen, and people are certainly giving in. There's another aspect then that we then saw unfold, which was really worrying, and that is the crematoriums, because there's certainly not enough space for people to be buried. Did you experience this with your parents as well?
For me, it was very easy. My parents died in a neighboring state called Haryana. And the arrangements made by that government were very good. There was an ambulance which took my parents in the bag to the crematorium, and then they themselves, the people who were wearing those suits, they only, arranged for the cremation and everything. My brothers only had to lit the fire that we do as religious, in our religion, we give the fire to the body. We do not bury it. So they helped us do everything. We actually had to do absolutely nothing in that thing.
That travel platform. These are unified digital platforms built and sustained through a public-private partnership among the AU institutions. On the one hand, and the continued private sector with support from the civil society.
We unfortunately got cut off there as we were talking to some of the residents in India. That was Rajashi Roy as well as Vanant Anant, who are both from New Delhi, who are describing to us a situation there that is really quite dire. Now, let's remember